Leprosy, also known as Hansen disease, is an infection caused by the acid-fast bacilli M. lepri and Mycobacterium lepromatosis, which are obligate intracellular organisms that cannot be cultured on artificial media. Humans are the primary carriers of infection and, in the US, the nine-banded armadillo is a zoonotic reservoir. About 200,000 individuals worldwide and 200 to 300 people in the US are diagnosed with leprosy annually. The most common route of transmission is through respiratory secretions, but skin contamination with tattooing and vertical transmission have been reported. Risk factors include close contact with a patient recently diagnosed with leprosy, immunosuppression, immunodeficiency, genetic predisposition, and exposure to armadillos. The clinical diagnosis of leprosy is based on the typical signs of skin lesions with hypoesthesia or numbness and nerve enlargement. Some patients may develop an immune response to M. lepri, called a leprosy reaction, which presents as urticarial swelling of skin lesions, fever, neuritis, erythema nodosum, and permanent loss of motor and sensory nerve function. Skin biopsy is the only laboratory test that can definitively diagnose leprosy. If skin biopsy is non-diagnostic, PCR testing of a skin biopsy specimen may be helpful. Early diagnosis and treatment are important to decrease disability and adverse psychosocial effects of leprosy and to reduce the risk of transmission. The WHO recommends a 6-month course of dapsone, rifampin, and clofazimine for paucibacillary leprosy and a 12-month course for multibacillary leprosy. Treatment with rifampin, moxifloxacin, and minocycline taken monthly for 12 to 24 months has similar efficacy, fewer adverse effects, and improved adherence compared with the WHO regimen, but is 4 times more expensive. Leprosy relapse rates after completion of WHO multidrug therapy are 0.77% for multibacillary leprosy and 1.07% for paucibacillary leprosy. Relapse rates appear similar after completing the regimen of rifampin, moxifloxacin, and minocycline. Risk factors for relapse include high mycobacterial load, increased number of skin lesions, insufficient treatment duration or regimen, and poor treatment adherence.
Thank you for listening. Subscribe to Diseases Simplified for more health tips and updates.